The Secretary General of the Kenya Medical Practitioners Dentists Union is Dr. Davji Atellah, and he's in the hot seat with us this morning. Good morning, Daktari.
Good morning, Joe.
How are you doing?
I'm doing fine. How are you?
Fine, thank you.
Yes.
Karibu sana.
Asante.
We have questions and the clarifications that were needed.
Yes.
And there's a lot of uproar about certain things and protections. We'll talk about those in just a minute. But Dennis this week takes us to Ghana.
Yeah. Have you ever eaten jollof?
Yes, I have eaten.
Which one do you like, Nigerian
Careful
or Ghanaian?
with the answer. Careful with the answer.
The differences are not so much.
Not so much.
Yeah.
But you don't want to
But
say
I think the Nigerian one sometimes has more chili.
Okay.
It's good for your stomach.
Yeah, so another thing other than that is fact that Ghana is the very first country in the continent to gain independence. You know, you talk about Kwame Nkrumah and the vision he had, and he said, despite the fact that we have independence, if it does not translate to the rest of the continent, then it would not make sense, you know. And you look at how even black Americans or African Americans nowadays go back to just retrace their footsteps where they come from to be in touch with their history. But let's go to the proverb. The lizard that jumped from the high Iroko tree said he would praise himself if no one did. How would you interpret it?
Yeah, repeat it.
The lizard that jumped from the high Iroko tree said he would praise himself if no one did.
Yeah, I would interpret it that, most of the time, with conviction, and when you take action to do something, you are doing it.
Yeah.
So most of the times you will expect response or praise or validation from the people that you're doing it from. But mostly, if you know what you are doing, then that conviction or that work that you're doing does not need to be praised. You just continue doing it.
Yeah. Oh, wow.
See?
Absolutely. That's great.
See?
Very true.
Mimi ni daktari anatibu wananchi. I need not to be told I'm doing a good job. I'm just doing it.
Exactly.
Amazing.
Amazing.
Gotta love it.
Okay, so of course, we heard an announcement that was made a couple of days ago. Actually, not more than a couple of days ago. But of course, that was not the day that the decision was reached to have a quarantine center set up for Ebola patients that come from the DRC of American citizenship. That was clear that it was not that day that the decision was arrived at. Now, it's also interesting to note that around that time, the KMPDU has given out a statement talking about this. And I'm going to read a little bit of an excerpt from that, which was signed by yourself. And you said that, as the vanguard of Kenya's health system, we are utterly disgusted by the government's apparent willingness to trade national biosecurity and the lives of its citizens for foreign aid. We will not sit back and watch Kenya be treated as a containment colony for a lethal pathogen that we did not generate. That's what the KMPDU said.
Yes.
Is that the case? That Kenya is actually opening up its borders for a lethal pathogen that it did not generate?
No, we are in a situation whereby we got to understand or get information first from America than from our country, where there was the Secretary of State, Rubio, came out and explained to Americans, and it was rightfully so, that they will not allow any Ebola cases within their borders.
Yes.
That even the victims of Ebola, those who are suspected or who are sick, will not be to America. And their plan then, therefore, was to, and this was a shift from the policy, where during the last outbreak in West Africa, the treatments of any suspected cases were being done in America. And then he continued to state that they have made arrangements that any suspected or a sick or a patient of Ebola will be brought to the country. So you see, that in itself was an indication that that there are going to be cases in the country. And the cases that are going to come to the country are not going to be those from the borders, but are going to be those suspected Americans from DRC to the country. So that's one thing that made us have this reaction. And it was because up to that point, there was no any communication from government on any arrangement that had been put in place. So to us, we were looking at this in a situation whereby, because as you know, Kenya has never reported any Ebola cases as much as we've had outbreaks since 1976. So we were looking at this, that the first time we're going to report a case, probably in the airbase that was being, the quarantine that's being put in place was from a case that is a quarantine for the Americans. And that's why we had that reaction. We're telling government, no, if you had an engagement with Americans, we need to know what is the content of this engagement. And if this engagement is for the Americans, what is the fate of the Kenyans? What plans are there to ensure that the public are actually protected? And why would it be that the American government have no interest in their own citizen, and they think that it is easier to bring them to the country? Does it mean that this virus that is dangerous is only dangerous for the Americans and not for Kenyans? So that was really the question that we were asking at that point. And then we are out to say, how was Kenya chosen to be the point of quarantine for this particular case? Because most of the time, when there is an outbreak, a pandemic like this Ebola, it's always much easier to have containment from the epicenter. That, I mean, every force, every effort, resources, expatriates, and health workers must be sent to that point so that you reduce the spread from that point. And now, what was informing the government to have, instead of containment at that point, have a new containment in the country. So those are things that you are trying to bring up, wanted to know, because there was no any information and there was opaqueness in all that discussion. And then what is the plan for Kenyans, those in DRC, those who are working in DRC, and then those who are in the country? Yes.
You know, Dr. we look at a situation where many are just asking very simple questions. If we are unable to deal with, every other time we're having cholera outbreaks in the country, and that's a concern. We have malaria in the country, it is a concern. We're also just having issues with our own health care, you know. And Kenyans are asking, if we are unable to handle our very own, then why would we invite something we've never dealt with as a country and expose us? That aside, they say it was signed during Uhuru's time. Why are we seeing it being implemented now? Should this fight go back to Uhuru's time?
You know, politics sometimes is very difficult to understand, and the way things are communicated becomes very different, because as much as it's said that this was signed in 2015, 2022 renewal, but we know that the agreements that we are talking about currently is based on a G2G agreement between the Kenya government and the United States government. And I'm saying this because the Trump government, when they came into the office, they were out quickly to get away from WHO and to do away with the US aid, the system that was designed to handle such scenarios of cross-border infections and epidemics. And so therefore they were trying to deal with individual government, of which in Africa, I think Kenya is the country that works very closely with the US. And therefore, what we are dealing with right now is some document that was signed on 4th of December 2025 by the Prime Cabinet with the American government on the cooperation. It is just beyond the epidemic and the outbreaks. There's also aspect of the digital healthcare, where they're supporting the system that's being used. There's issues of health workforce. There's an issues of commodity that are there. The essence and the concern that, I mean, we have as health sector, and that was all there with the public and even the civil society, was the opaqueness of all the conversation. That when you have an agreement and you have, in fact, that was bringing an approval for the data, the issues of data in December, that there's need to bring people on board to understand and to see the implementation, so that accountability can be part and parcel of the conversation. When it is said that US has been supporting the healthcare of Kenya for over 60 years, with about 20 to 30% of the health budget that is being used in the country as partners, it is very clear to see that money, what value does it have to the Kenyans? And that can only be understood and can only be appreciated when it is transparent, there's accountability to it, and there's understanding on what value it's bringing.
Dr. As key stakeholders in the health sector, right, such decisions would inform involvement, would inform participation from you in terms of knowing what the government has put in place to secure its citizens from Ebola. What you're hearing right now is that the US government will handle its business on the side. But what happens if that gets to 1 inch, if there is Ebola in the country today? Is there any plan that one would say, we have enough plan around handling Ebola, that even if the Americans are coming in, are setting up the thing on the side, we as a people, as the government of Kenya, as doctors, we are sure we are able to handle that? Is there any plan that you would say is concrete?
You know, at the time that you were giving our statements, the only conversations in the country was about the quarantine that was being set up for the Americans. It was after the reactions of the public, the civil society, the unions, and the public generally, that the Prime Cabinet came and said that there are 17 other quarantines that are setting up for the country. And the Cabinet Secretary came out and said that they've been trying to do more of these particular isolation units, quarantine, and having plans to have the Kenyans protected. Yesterday at night, I saw the President, when he was in Wajir, he said that it's not only the Laikipia quarantine that is being talked about, there are other 23 others across the country. I mean, that if that is the case, that's a lauded issue. That we must actually laud that. That's a good plan. But one thing we keep on insisting, it shouldn't just be that it is there when there's a reaction to our concern. We need to consume this information, and we need to be able to actually affirm that it is a reality before we come out gunblazing about what is not happening. And number two, when we say we have over 23 of them, we need to see that, okay, how are they equipped for the public? And how will they be able to help the public? Or are they just like those schools that were done during the COVID-19 time? That's something that we need to ask the government to actually explain. The other thing is that in terms of, because we know one thing, when we have Ebola cases, we need to have a very strong intensive care units or support for the patient. Are they equipped to such an extent? The issue of the health workforce, which also was part of our statement, we have a shortage of healthcare workers across the country. That normally, if you go to the hospitals, the waiting time to see a doctor is always over 12 hours, sometimes even up to 24 hours, and that is both in the public and private hospitals. So. And even the time we have seen the ratio of the patient to of the nurse, with the patient to the nurse is very high. It's very high. We've seen cases whereby, because the nurses are not there in the hospitals, or there are very few, there's the cases whereby we lose the patients. So the reality is that when we are talking about the 23, we are talking about preparedness. Has the government employed more health workforce, or have they put a plan to have more health workforce? Because ideally, Dan, when you have Ebola cases, the number of health workers that are needed to manage a case increases. You need like 6 nurses to manage one Ebola patient effectively. You need two physicians. So the health workforce is more. And that's why even during these outbreaks in Liberia or in West Africa, you realize there's a mobilization in African Union to have healthcare workers. Because when they are few and they have a longer exposure to this particular condition, themselves get exposed. That's why we have cases of healthcare workers when in DRC getting sick. So in reality, when we have these preparations for the quarantines, we need to see actions. We need to see employment of health workforce across to not only work in these quarantine points or to help to be preparedness, but to actually make healthcare functional. Because it is not possible to say we are preparing for Ebola when we can't manage choleras or we can't manage pneumonias.
Okay. And have any of those questions then been answered? Because you said that the statement came out because there was very little communication in terms of what was going on. Have any of those questions been answered to a satisfactory level now, whereby you can then say, well, if there's going to be a center, then make sure you hire more doctors?
Most of the questions that we have answered, most of the concerns that we raised are in the process of being discussed, and mostly in the media.
Okay.
We have not seen, I would say, a correspondence to what need to be done. We need to see these things. We just need to hear about them. And that's one thing that I think the physicians also have talked about. There's one thing that made the civil societies go to court, that show the public what is being done. That this particular order that was gotten, that was stopping this quarantine and was stopping the isolation, the one of Laikipia. It's fundamental thing that was asking is about the transparency. What is the plan there for the Kenyans? And if this is being done, what is it about? What about it? What are the safety nature of the situation? And this is something that you cannot just respond on the media. You must have the stakeholder engagement. Let people know what's happening. Let the healthcare workers know. Let the civil societies know. Let the public understand what is happening. Because that's the only way that you build confidence to what is being done.
Yeah, okay. From a medical point of view, are these partnerships normal of this nature, whereby, like you say, there is a disease that is it's a dangerous one. Have we seen partnerships like this between nations whereby you off-take the infected and quarantine them for a time until they're well? Is this a normal practice from your understanding?
There's the two things here. There's what we call the quarantine aspect, and then there's isolation.
Okay.
For example, when you, like now we know that the epicenter of Ebola is in Kavi region of DRC.
Yes.
And so anybody who travels from there has a possibility of being a suspect, like having interacted with somebody probably was infected in that place. So when you are from that particular situation, one thing that first happened is the quarantine, so that you for this strain is like 21 days to ascertain that is there any disease on you.
Okay.
So within 21 days quarantine is just to hold you to check whether there's a disease.
Okay.
Once, if it is confirmed, you are tested and you're positive for the disease, then now you go into isolation separately.
Okay.
Yes.
So what is Kenya setting up? Quarantine centers or isolation centers?
They are interchangeable, but they have to be set up, all of them. You must like you
Just
must
in case.
quarantine. You must quarantine highly suspected individuals before they're isolated for treatment.
Okay,
Yeah.
so
Yes.
it's normal. Are
It's
we
a
saying
normal.
it's normal that a country would off-take?
Yes.
Because this is in the public glare, where Marco Rubio said very clearly that we cannot affect the American
Americans.
people. That was the first port is to say there will be no discussion about whether we will put the lives of the American people at risk crossing over their borders. Now, whether there was an agreement in 2015 with Kenya to set up isolation and quarantine centers in the event that a disease would make its way in whatever area, that's another conversation that's building over time. But has this happened? This is my question. That it seems like the next normal thing. Whereas your good friend P.S. Oluga has said, you know what, guys, we did this with COVID. We did this. This is no big deal. Is it a big deal? That's the question. Or is the outrage for outrage?
The big deal comes in at a point when the American government and American leaders come out and say that this disease is very dangerous to the point that we will not even allow our citizens to come back to the country.
Yeah.
That in case there's anybody that is suspected or is infected, we will not allow them to be even within our borders. And then they proceed to say that because of that, we have set up a quarantine or a place in Kenya for them.
Exactly.
So it comes out, okay, fine, that is a very good communications for your people in America, because then they're protected from any danger coming to them. But then there is no, then it also means then there's no value for the people in Kenya where this is going to be done.
Exactly.
Yeah.
And could
Exactly.
Kenya not have said no?
So that's actually what elicited the reactions.
And from a medical perspective, taking into consideration that your PS in health is a medical doctor who understands a lot of these things, and also then take into consideration that there are many health professionals, the KMPDU, for example. You have doctors who sit on the health committee in Parliament. You have all of these individuals who are available in the country. Did Kenya have to say yes? Or was there something that binds Kenya to then agree to do this? And I'm talking from medical points of view.
When you look at the issue of when there's an outbreak like this, or rather there is a pandemic like this, I think also it's very responsible of the American itself to say that they will not have even a quarantine point in America. Because the time it takes for even the symptoms of Ebola to be seen, as for this particular strain, is over 21 days. So there's a possibility. In fact, there were reports that are being indicated that there are cases that are being seen now up to Brazil and South America. So there are chances that if they don't have that particular quarantine point the way they were putting it, then it is a possibility of then a person who is getting in without being noticed. And that's why, as much as that was said, they have actually plans to ensure that there is no surveillance. The point in case on this scenario is, and what is causing the concerns that we had raised, and what actually government ought to look into very strongly, when there is an outbreak like this, a lot of efforts need to be at the point where the disease comes from. We need to see as a country, how do we support Congo or DRC to ensure that this disease ends, that the people that are there are treated and are supported, that we lose less lives in such a scenario. And the same with Uganda, because when we have containment and support within that region, then it means that we'll have less cases of spread of the disease across. But when there's a panic where different countries feel like they cannot be safe to have containments in Congo, and then they have it in other particular countries or other places, then it then means that we can actually have new cases now being carried from the distance of, let's say, like Kivu to Nairobi to Kenya, over 2,000 kilometers. And that's why before that is done, there's a clear way that things need to be put up in place, that there's protection. Yeah.
You know, Doc, we talk about setting up the Ebola quarantine facility at Laikipia, which is, one would say, is a military facility meant for Americans. That's fine. But we also have to look inward as Kenyans and ask ourselves, how are we dealing with the border at Busia? There's a Kenyan here who's a listener who's saying, we can't talk about setting up a quarantine facility when the borders are still porous with Uganda. You know, we are not even having discussions on how we're going to protect ourselves from Ebola crossing over through the border alone. We are not having those discussions inward as Kenyans. The government is not assuring Kenyans that there is proper surveillance, there is proper monitoring of individuals who have entered the country, say, in the past 21 or 30 days, to be able to know who has come from DRC, from Zaire, for us to know we are doing something right. Can we talk about setting up a quarantine facility without telling Kenyans how you are preventing Ebola from getting into the country to start with?
I know that many countries have not closed their borders because of this particular outbreak, except Uganda that closed the border for DRC because we're seeing a lot of the disease crossing over in their borders. But I believe that just I believe, because I don't know, that these particular 23 quarantine points that are talked about by the government should be at these particular border positions, because I mean that is the most high places there where we would have high suspicions, and also around these particular points of entry like the airport and the likes. That's one thing that I will suspect from this particular conversation. But then also giving credit where it's due, that we have had these cases of Ebola since 1976, different outbreaks. In fact, if you look at history, it's almost every 2 years there has been outbreaks either in DRC or in Uganda or in West Africa. But we have not had any case that has been reported or confirmed in the country. So it means that whatever surveillance has been there, to the extent that it has been, it has made sure that we have not had a case in the country, because we are quite close proximity to Uganda and even DRC. But because this one is coming at a time also when there's an extensive war in DRC, and we've had reported cases whereby the quarantine units in DRC are even being burnt down by the community, so people end up mixing down with the community, and that means that there's more spread. And I think this has well been reported by WHO. So ideally, this is a time that government need to give more confidence to the public, and not just by talking, by showing what they're doing within the borders. And see, also health is in Kenya is very different, because there's an aspect of it that is devolved. So it means that the county government must be brought on board so urgently and so quickly to also reinforce the same standards of the policy pertaining to the surveillance and pertaining to actually ensuring that those border checks are actually working.
Okay.
Yes, so that's one thing that need to be there strongly. But also, as I keep on saying, this cannot just be there by word of mouth. This has to be there by us seeing what is being done. And the biggest impediment to any health services in the country, I can keep on saying, is health workforce. If you say you've deployed 1,000 health workers or 2,000 health workers to help handle the issues of Ebola, and we have not seen employment of the same, then we are wondering, have they left the wards into the surveillance units or to this screening? Because that is key. We need to see health workers actually being deployed, being employed and deployed. Yes.
Do you have any information of any deployment so far? of any health workers?
What I know is that the permanent secretary for the public service said that they are deploying 1,000 healthcare workers to help in screenings and in mitigating within different quarantine units that they are indicated. But we have not seen those recruitments, so we don't know whether it is requesting from the counties or from the ministries, from different ministries. Because what then need to be done is we need to see. Yes, because as I said, we have a shortage. We don't have health workforce.
Okay.
Yes.
Who are these quarantine centers for? And I ask this because it's clear from the information that we have so far that the infected Americans or the suspected to be infected Americans will be in these quarantine facilities. Are they for anybody else? Will anybody else then be able to access these facilities if the need arises? Or are they just for Americans?
You know the quarantine that put up for a pandemic like this, like COVID-19.
Yeah.
Essentially, they should always be for anybody suspected to have traveled from the disease-prone region, like from the Congo or from the Uganda part of it, essentially. And that means that when you are suspected, you will stay there and be monitored for the number of days that for the symptom lesion is 21 days, and then you're okay, you're released back to the community, and if not, then you go to the isolation. That's essentially what it ought to be, and what ought to happen within the quarantines. But then what was causing the uproar over the Laikipia airbase quarantine is that it was not going to bring the suspected. It was not going to be like a place for screening. It was definitely going to pick or to take the DRC Americans and then bring them there for quarantine. And that was the concern. And therefore we came out and asked, why only the Americans? What about these other the Kenyans? And then the minister actually tried to answer that and said the quarantine is open for the Kenyan military, for the Kenyans who are working in the DRC and all that for that particular purpose. From that point, I feel like the concerns that union, like we had, the concerns that civil society have, the issues that was raising a lot of concern, in a way, is being discussed. Because initially nobody was talking about the quarantine unit in Nanyuki. Initially nobody was talking about the plans of this quarantine 23 that have been put in place. The plan government had for the public that was not there before. So in essence, I think the reaction, the concern that the public have put up to the government
is what has made them
is making them now to come up with all these particular responses.
It's interesting.
Yeah.
So I mean, let's look into some brick and mortar here. What happens in a quarantine center? One would imagine that there are patients who obviously would be there and they're being monitored, treated, and then in the unfortunate event of death, for example, that is then taken care of and, things are moved. But that's just an understanding. From a medical point of view, what happens within a quarantine center, number one? And number two, who are the medical... because you've kind of segued to that with saying that then hire medical staff from Kenya. So is the assumption that the medical staff who will be working within these quarantine centers are American doctors who've been flown in to handle this, and only them?
Every quarantine may be set up in different with different level, depending on why it has been set. But ideally, if you go deep into identity of quarantine and isolation, a quarantine, like for example, the one that is the National Police setup around Kenyatta, the region, is that once you're suspected at the port of entry, then you are there to be monitored. They will check the normal temperatures, the normal vitals, to whether there is any indications of any of the symptoms for the disease. And if it happens that within the period, that is the incubation period of the disease, there is no symptoms, then you are free. You are clear free to leave the quarantine unit. But if you develop the symptoms and then the test confirms the disease, and then now you go into the treatment, to isolation and into treatment, depending on the severity of the disease, is when they will indicate, do you need an intensive care unit, or do you just need the hydration? Whatever nature of treatment you will need for the disease, will be accorded accordingly. And as we have seen also with this particular strain of Ebola, there are no vaccines, and there's no a particular treatment that has been regimen for it. So most of the time, it's just
symptoms.
It's just treating the symptoms, and with the hope that the body will eliminate the virus. And I think the reported cases so far of more than 6 people that have recovered. So essentially that is it. So it has mixed skill of workforce within it. We have the physicians there, we have the emergency medical personnel, we have the nurses, we have the clinicians, we have the pharmacists, we have all the mixed skills within these particular setups to ensure that there is actually proper healthcare.
Okay.
But now, if you get down to the one for Laikipia, because this is something that is happening, but we have no understanding of the components of it.
Okay.
The information from the media is indicating that the Americans and American Corps were bringing their personnel to manage the conditions there. And the other information from America and from the media was also indicating that it was more of a field quarantine, that once they have the personnel, the suspected, and then they get sick or have symptoms, then they will be flown to Europe for treatment. That was the information that was there. This is not confirmed or verified by anybody from either the government of Kenya or from the quarantine base. And that's why we wanted to understand what sort of a quarantine unit was being put there. And if it is indeed open to the Kenyans as well, then in what nature? And does it mean, and this is something we keep on asking, I think it has been denied by government so far, that they're not going to bring any suspected cases from DRC to the point. You get the point? They're saying that this is an open quarantine just like the other 23. That can only be confirmed by reality when they actually show it. And that's why we were bringing the concerns that what sort of a quarantine is it.
Yes. Because, because when you talk about it being like any other quarantine facility, and the reason why this is actually as huge and being a discussion point today is because it is being built by the American government in a military facility. Kenyans yesterday tried to access the construction of that quarantine facility. They were not let in because it is in a military facility. Therefore, we cannot be told that this is any other quarantine facility because of where it is constructed and who is constructing it, so that disqualifies that argument to start with. But that notwithstanding as well, we are saying we're dealing with this virus, but we're not seeing research that is going into it, or rather heavy investment that goes into it, perhaps even with support from the United States government. Here we have a story where WHO has warned against the use of Kenya-tested Ebola virus vaccine in current outbreak. The Budi-Buji virus that currently is there is a new strain. We do not have vaccine into it. But would you say, based off information that you do have, that there is research that is going into producing the same, say, in the country, and there is heavy investment on that?
In the country, I'm not certain of, and I think I will be rumor mongering if I speak to it. But I know that of the WHO, and I think the WHO director has been ideally in Congo, and one key statement that I put that they're actually doing a lot of research to try to get the vaccine for this particular strain, and even to get the antibody treatments for it. So that's actually something ongoing. And if you look at it from the report, it's not really the first time that the Budi-Buji strain is being reported. So it means that there's just been a delay on research on it that I must put. But then for Kenya, for us to really be part of a success to all this process, it means we have to invest in it. And we must not just be reactionary to the same. I know government is saying they have a very good relationship with the Americans and with the other African countries. That relationship can only come up when there's much more value to the Kenyan. And that's what we keep on saying, that we want to see. You see, the Americans have the interest of the public, the American citizen. The same.
It's the number. It's not just an interest. It is the number one interest and priority.
That same has to be the number one priority for the government of Kenya and the persons in the office. In every engagement, policy collaborations, in partnerships, and that should be the major thing.
Which then brings me to the next question, Daktari. In this interest that we see today, and even in the setting up of this quarantine facility that would see Kenya record its first confirmed case, is this in the interest of Kenyans or in the interest of Americans?
We have indicated it out clearly that when you have a disease in, let's say, like Congo, and then you build a quarantine 2,000 kilometers away from it, then it means that it creates another epicenter in that region.
Mm-hmm.
Because then that means that the first case that Kenya would record will be based on that import to the country, which so far have been denied, but that's the reality. And then the management of that is very key indicator to show that will that be spread within that region and in the country. Because see, as much as we don't know the information on how the quarantine will be working, then there's no surety that whatever happens there will be protective to the people. Because the Kenyans, I mean, this is a military base, yes, for the Americans, and we have the military people there, and we have different service workers in that particular place. But they interact with the community.
They buy food from us.
And yes, they drink within those particular clubs. That's why we even have, some of them have children there. Some of them have husbands, some have wives there. Mm-hmm. So you can't just say, no, this is a different. Citizens are living within the country, within the airbase, then there's no interaction. If we think like that, then it's not possible to prevent spread or an outbreak. Mm-hmm. But when we know and come out openly and transparently on the situation, then it is easier. And you know, sometimes I keep on saying, what brings the outcry, the reactions of the public and of organizations against some of these particular moves of the government is lack of transparency and the communication. Because if all this is communicated prior in time, understanding is put up in place and plans are put, then I don't think anybody will come up to object.
I think they would come up to object, Daktari.
Yeah.
Because at the end of the day, what we're looking at here is a cross purpose. That the country that is bringing, because we can try and talk about the politics and all of it, but the country that has refused to have this disease cross its borders is saying, take our infected people, put them in your country, we will fund the facilitation of these quarantine centers or whatever the case may be that you need, but keep them over there. And so it's beyond a political conversation. It talks to things like state sovereignty.
No.
It talks to things like protection of your own people. And until and unless somebody is bold enough to say, number one, be transparent. If you're not transparent, then do this. It's beyond transparency, Daktari, because here you're saying, what is Kenya doing? What is Kenya doing to protect its own people? Because one case that seeps through those quarantine centers might be unmanageable for Kenya. That's the truth.
But no, there's one thing that we must agree, that by the time that this is not talked about, this people knew it was wrong.
Indeed.
Mm-hmm. And if it was to be talked about and discussed with the stakeholders and with the engagement, it would have been a different approach. And that's why I'm trying to put it out clearly, that when there's transparency, there's communication and there's discussion to what is being done,
then certain things will come out into the open.
And certain things will be done differently. Mm-hmm. It will be that, yes, the quarantines are built, but they're built across the country, but they're not built to import people.
And that's the point. If there was transparency, you could actually be at the position where you say, not done properly, but not done at all.
Yeah.
You see?
Yes.
That you could actually be at a place that we're not even having this conversation.
Yes.
That something else could be the case. You figure it out. But that Kenya is so openly welcoming this without a conversation with its people. By the time Marco Rubio sits in a press conference and sits next to his president and has a conversation about how we're not welcoming Americans, it's not just the two of them. There have been lobby groups, there have been the medical fraternity, there have been institutions, there has been America CDC who have said, you guys, you know what? Congress, this is our position. They made a statement after they had public participation, the things we yap about here, but that doesn't happen. They made a statement, not on their own cognizance, just the two of them, but there are institutions behind that who've come together and said, you know what? Protection of American people, number one. So you guys go out there and say that. But it looks like it's the opposite on this side, where it's okay, let's do this and go ahead with it. And then if it seeps out, we know what to tell the people of Kenya. So much so that there's a court order that has stopped the procession of this thing, but that doesn't seem to matter. Today is the 2nd of June. There's supposed to be the process in court about what all sides will be heard, so that the court can pronounce itself. From where you sit as the KMPDU, the body that one would say, okay, could be the one on the forefront, actually saying, excuse me, what are we dealing with here? Understanding the medical repercussions, understanding the social issues that surround this, politics aside. If a court has pronounced itself about how this process should or should not continue, but that doesn't seem to be adhered to, then in what position does Kenya actually find itself? You are not deaf or blind to the medical situation in the country. Take COVID and toss it out take Ebola and toss it out the window for a minute. How are you able to handle things that are killing people? In fact, when COVID came, malaria and HIV looked at it and said, excuse me, take a number, because we are still here. Unable to handle a number of things, and then you're coming to add a potential risk. So who made the decision? And are we not looking at deeper issues here, whereby the medical sovereignty of a state could be compromised severely because people made a decision based on dollars as opposed to the people's protection?
If you look ideally even to this American CDC, they did not support the stance of the government of America, where they were saying that they're doing a quarantine in Kenya and not allow any American citizens, the victims, not to be airlifted to America. And they say this based on the outcome of the cases of Liberia, where all the Americans who were airlifted from Liberia, from the West Africa, and taken to America because of the nature of the investments in the hospital. None of them passed on. All of them recovered.
Yes.
So.
So they're saying that they could actually treat them better in America.
They were treating them better.
That's what the CDC said.
That's what the CDC said. And they said that the decision to actually transfer the infected or the suspected from DRC to Kenya, and the new policy that doesn't allow them to go to America was wrong. So that is the decision, and that's the statement that has come from the CDC. So if you look at that, and look at what we have put up out there, that when you bring a disease from, let's say, DRC to the country, there's a problem. To Kenya, there's a problem. So the decision that was made based on this was a political decision. And the reality of it is what is making us have this conversation, saying the government that the issues of healthcare and the sovereignty of people, in every decision you make, in every situation, the Kenyans must come first. And we must protect the Kenyans in any of these decisions. Yes.
Simple question. America has said no to its people. They've said no to the infected Americans. They will not come home. You get?
Yes.
You might as well go get treated elsewhere, but we will not allow you to come back home if you have Ebola virus. Kenya and the United States of America only have bilateral arrangements. We do not hold brief for American citizens. Kenyans are asking, who is holding brief for Kenyans? Can Americans decide on matters to do with, on medical terms, what is happening or what should happen in the country from medical perspective?
No, they can't really decide. But you see now what happens here, and if you put this out very clearly, the money. You see,
that's where it's at.
That's where it starts, and that's where that's where the thing is. And I think from the communication from government, they've said the percentage of healthcare that are being supported by the Americans, not now, but for quite a while, is what probably drove them to that decision. But now that decision in itself, is it positive for the Kenyans? And that's why we have these reactions. That when you're making a decision, despite the money, despite the support, will the consequences of an outbreak be more devastating than the support that we are getting?
Would it?
Definitely, if there's an outbreak, that would be the case. And that's the question that need to be answered by the decision maker in this particular process. And that's why we came out to push the idea.
So it seems to me that there should be a greater push. We can talk about it here, but when we're talking about the protection of people, it seems that there should be a greater push. And I'm coming back down to the doorstep of the KMPDU. Because yesterday, after the Wajir celebrations, the president said, he didn't say someone, I allowed the US to set up a quarantine center in Kenya, and there are 23 others. He said this, and I'm quoting verbatim. Now, in that place where you could actually say, excuse me, Mr. President, if we deal with a situation where one person is infected and can touch another person and be in the presence of somebody else, we will be dealing with something that we are unable to handle. It's not politics, it's not romanticism, it's the reality. That Kenya right now, because that's the thing about these things, can you see somebody who's in the incubation period of Ebola and know that they've been infected? You cannot. I cannot look at you, you cannot look at me and say this person is infected, because I could still be in the incubatory period. We know this. Now, if you're dealing with such a thing where there could be people milling about, like you said, people who leave that base are sitting having a drink at the end of the day. People are frolicking back and forth with people within bases. We know this happens all the time. Kenya is unable to handle its current medical concerns, without anything else added to it. Those should be the push behind the conversation that we don't hear happening. Who's to push and say, Mr. President, in this case, sir, this could actually be detrimental to the country?
I believe that even up to the point that we have this particular court order, it shows that there's consciousness among the public and among the people that they want answers and they want actually responsiveness from the government. And that's why we took a very strong stand on this particular issue. Why? And if you look at it, it is, and we have put it here, that it's out of the concerns of the public that the government is actually now speaking. It means that whatever we people are demanding on this aspect is the protection of the Kenyans. Up to the point that we have a court directive over this particular matter. I believe that when government decides to not comply to court orders, that becomes a different issue, because the courts do not give decisions or directives in vain. And whenever orders are given, ideally, they ought to be implemented. And when government or persons in office start by not disobeying, that it encourages the public, the civil, the society, to then look for different avenues to enforce those particular directives. So, and that's what will be happening in the courts today. The directives will be, the people will be presenting, this is the direction that courts gave, and this is what we expect. So, no, I don't agree with you that the people have not risen up to ask questions on this matter. I think to every extent,
not just ask questions, to push and say that this situation should not be.
You know, even the conversation here, the essence of it is to push and to make sure that there is an understanding why this is happening and to ensure that it stops with the aim of protecting the public. And even when people go to the street like we saw, that they display the outrageousness. The only problem we raise sometimes is reality. Things that we discuss tend to sometimes be politicized. So people pick those things and take them into different situations that then now dilutes the reality of how we can solve the problem.
Indeed.
But still, engagement of the stakeholders, like we saw the physicians that came out very strongly on this matter, the civil societies, the union, it is key that we must all have answers. We must all be ensured that we are protected.
At the core.
That's the core.
Indeed. Today's June 2nd. We're going to hear what the courts will have to say in terms of that process. And it's not dead in the water. And that to hear that groups will come out and say the protection of Kenyans must come first, just like those of the Americans. Indeed. Secretary General of the Kenya Medical Practitioners Dentist Union, Davji Atellah Daktari, thank you for joining us this morning.
Thank you.
One to watch. And we'll call on you again to hear what the next thing will be. Hoping you will come.
Thank you.
Asante sana. Good morning.
This is the Situation Room. The only way to start your day.